Welcome to When Food Meets Medicine, the podcast where we explore how what we eat affects how our medications work and how your health thrives. Dr. Remy Olukoya, a pharmacist who believes that food and medicine are partners, not competitors in your health journey. And today we're talking about something that affects millions of people but doesn't get nearly enough attention: the connection between chronic disease and infectious risk. If you're managing diabetes or heart disease, kidney disease, or any chronic condition, you're at high risk for infections. And those infections can be more severe, harder to treat, and more likely to land you in the hospital. But here's the good news: you can protect yourself through smart medication management, poor nutrition, and preventive care. You can strengthen your immune system and reduce infectious risk, even with chronic disease. So, I'm absolutely thrilled to welcome today's guest. He's a physician who is dedicated over decades to understanding and combating infectious disease. His passion for education and global health is truly inspiring. Dr. Folarin Olubuale is an MD, an internal medicine and infectious disease specialist with clinical experience spanning both Nigeria and the United States. In Ibadan, Nigeria, he completed his medical degree at the University of Lagos in 1983. He moved to the US in 1989 and completed his infectious disease fellowship in 1996. Since 1997, he's been a respected leader in patient care and clinician education in Columbus, Georgia. In 2007, he launched the Infectious Disease Annual Lecture, which is now a cornerstone of continuing medical education. And he founded the Global Infectious Disease Initiative, a charitable organization improving infectious disease care and education in Nigeria, with their first international event in Lagos in 2017. Dr. Olubuale, thank you so much for being here. Your background is just phenomenal, and I know our listeners are going to gain so much from your insights. So let's start with the big picture.
Thank you very much.
So today we're going to talk about what many of our listeners are managing. They're managing conditions like diabetes, heart disease, autoimmune disorders, and kidney diseases. They might be very focused on their blood sugar or blood pressure. Could you explain for us in simple terms why having a chronic disease often makes someone more vulnerable to infections?
Well, thank you very much, for that question. Of course, chronic disease like diabetes, especially, it's a disease that destroys you over many years. Unfortunately, before patients become diabetic, their problems have started many, many years before then, By the time the full picture is showing, the disease is probably about 10 years. So that's a big problem, for the, type 2 diabetes. There are two types of diabetes. Type 1 diabetes, those are the ones that lack insulin. And the type 2 diabetes patients, who are usually the older patients, who have insulin, but, their system, their muscle, their liver, other organs, they don't respond to the insulin as the way they're supposed to respond to it. And so these patients are sick for a long time. And it affects the whole system of the body, from your brain, to your blood, to your bone, to your kidney. The big ones are the vital organs, like the heart, they develop vascular problems, they develop coronary artery disease. The kidneys over time too, because this disease affects the blood flow, the arteries, to all these organs. And with time, it compromises the blood flow to these vital organs, and destroys them over time. It destroys, the blood flow to the brain, they develop stroke and all the rest. All these things predispose you, developing, of course, infection along the line, based on the fact that, the base of diabetes is that your blood sugar is very, very high.
Yes.
And of course, one of the things that infection, generally bacteria, viruses, they like sugar.
Yes.
So when your blood sugar is very, very high and you don't control it very well, it affects your immune system basically on the cell level and on the bacterial level too. So that's a big problem, for the diabetics. For hypertension, it goes along with it. They go hand in hand most of the time. If you're diabetic, most likely you're going to have some blood pressure problem too. Diabetes is the big one, it's a big killer, for most people. Like, they don't control it very well. At the end of the day, it's going to catch up with them, and it's going to affect them. They have stroke, they have a heart attack, they have amputation of their legs if they don't take care of their blood sugar.
Their blood sugar.
And of course, infection sets in all these virusides, The one that I see the most in my own specialty, infectious disease, is mainly the diabetic foot infections. They develop blood flow problems in the legs. That blood doesn't flow very well there. They
Yeah.
need to probably have to, do surgery on their leg. Sometimes they need to amputate it.
Mm.
And those are big problems. For whoever the
So it makes so much sense because it's like your body's natural defense system, it's like it's working overtime or it's a bit compromised. So for our listeners managing multiple medications for these chronic diseases, are there any general classes of medications that might further suppress the immune system, maybe making this risk even higher?
Well, yes, of course. There's some. It depends on the underlying other infection, other problems they have. Of
Yeah.
course, if they have like vascular problems, vasculitis, lupus,
Yeah.
like some other conditions that need steroids that they need to use. Of course, this will increase their blood sugar, which
Yeah.
will make it more difficult to control the diabetes mellitus. So it depends on the other things that they have. There are
Mm.
immunosuppressive agents too that people use for all this, for some cancers too, and all the rest that can,
Yeah.
increase their risk, for developing infections too.
So yeah, these are crucial points for our audience to be aware of. I know that diabetes could affect your immune function and infectious risk. So now we're going to zoom in on diabetes a bit more, as it's so prevalent. We often hear about complications like neuropathy or kidney disease, but the link to infectious risk is often understated. Could you? I know you spoke a little bit about it, but could you elaborate more on exactly how diabetes, particularly uncontrolled diabetes, impact immune system, how it increases susceptibility to specific type of infections?
Okay. Thank you very much for that question. The underlying problem with diabetes mellitus is that, like we said, you're suffering, you're starving in the midst of plenty, like starvation in the midst of plenty. So
Yeah.
all your cells, in your body, they are not, because you need glucose, to function very well, you
Yes.
know. So
Yeah.
all organs that's, in your body that that needs blood flow, that needs insulin to function, they don't function very well. So
Yeah.
what will happen now is that, with time, they're very prone to developing, some kind of pneumonia. And that's why recommend that they should get pneumovax, vaccination, so that to prevent them from
Vaccination.
getting
Yes.
pneumonia. Yeah. So that's a very big problem, for diabetic patients. Diabetic patients, develop a lot of urinary tract infections too, depending on the
Mm.
medication they're using. But sometimes if their blood sugar is very high and they are urinating a lot of sugar in the urine,
Mm.
that's a risk factor, for developing urinary tract infection. I've mentioned the food infection. They develop infection of the food,
Mm.
cellulitis. They develop
Yeah.
osteomyelitis of the food. They develop any part of the body is prone to developing infection if your blood sugar is very high and it's not well controlled.
Are there any particular food drug interactions with this diabetes medication that patients should be especially mindful of? Maybe interactions that could indirectly affect their ability to fight off those infections, or even just their overall well being that might make them more vulnerable. I know, for instance, alcohol interacts with some of these medications, and what impact could they have?
Yes. Well, bottom line, the most important part of management of diabetes mellitus is your diet. That's the bedrock.
Yes.
You have to maintain, very good diet control, maintaining your carbohydrate intake, good exercise, maintaining your portion, and eating very healthy and exercise. Those are
Yeah.
very good, important things. Nutrition-wise, of course, if you eat food that's very high in carbohydrates, it's going to affect your blood sugar. It's going to make your blood
Yes.
sugar very high. Sometimes, it's not a bad idea um, if patients are able to get the help of dietitians, like
Yes.
nutritionists, like actually teach them on
Yeah.
how to eat. It goes a long way.
Mhm.
Of course, any medication, like you mentioned, the corticosteroids, and the alcohol, like you said, alcohol, of course, is loaded with the carbohydrates. It's going
Yeah.
to increase your
Blood
sugar
sugar.
load, and it's going to
Hmm.
make your diabetes out of control. But the most important thing too, you as a patient must love yourself. You must want to live. Because if
True.
you don't want to leave, if you are not compliant, because compliance is very important. We
True.
as doctors, we can write, whatever we want to write for you. But if you're not taking your medication very well, if you're eating what you're not supposed to eat, if you're not exercising, if you're not following up with the doctor, you're
Mm.
going to be in trouble. So I
True.
will employ, we as a diabetic to follow those things, to make sure that, your blood sugar is well controlled, is well followed. It's a team thing between you and your doctor. I mean, you
Yes.
have a lot to do yourself. I
Yeah.
mean, you're going to be the one to monitor your sugar, you're going to be the one to check your blood sugar where you're supposed to check it. If you're using insulin pump, you're going to be the one to use it. You're supposed to be the one to know when your medication is running out to ask for a refill. Okay.
Yes.
So
Yeah.
those are things that are important. Yes.
I totally agree. So we're going to pivot to antibiotic stewardship, why it matters for patients. I know that when infections do occur, maybe antibiotics are often prescribed. And I know you've been a leader in antimicrobial stewardship in your practice in Columbus, Georgia. For our listeners, what exactly is antibiotic stewardship and why should they, as patients, care about it? How does inappropriate antibiotic use not only affect them personally, but also the broader community and what role they can play?
That's a very good question you asked, which unfortunately the patients themselves have a lot of part to play in this. Okay. Antibiotic stewardship definitely just means that, using antibiotics appropriately, knowing when to use antibiotics and know when to use it, knowing how long you need to use an antibiotic for a certain condition and when to
Yes.
stop it.
Yes.
Is antibiotics needed or not? I'll give you a good example. Like the common cold, people have runny nose and all the rest. They have a little cough. Most of the time, of course, it's a virus, that causes all this infection. But I mean, as a patient, you go to see the doctor, you complain to the doctor, and the doctor tells you, no, you should be okay. You should take some Tylenol, drink a lot of fluid. Things should be okay for you. Of course, for your doctor to say that you don't need antibiotics, of course, they know what they've seen. Okay,
Yes.
but the patient will say, "Wow, this doctor doesn't know what he's doing." And they'll go to the next doctor, whom they'll tell the same thing, and the doctor will write an antibiotic for them, which is very bad because what happens is that, when you are putting pressure on this bacteria that we are talking about, we are talking about bacteria generally. If you are putting undue pressure on them, what you're able to do is that you're going to stand the risk of making them develop resistance to these antibiotics that we're using. It's a big problem all over the world. There are a lot of organisms, I mean, bacteria. I mean, I don't have to start naming ones that are very difficult to treat now. That I mean, they used to be very sensitive to some common bacteria antibiotics, but now
Antibiotics.
because of all the pressure, it's very difficult,
To
to get
resistant to
antibiotics.
it
Yes,
now.
oh,
Yes.
yes. So that resistance thing is a big thing, not for only you, but for the general population, because there is the risk of taking those bacteria from one person to the other, and at the end of the day, start having problems in treating that patient with the common antibiotics that's supposed to be used. So antibiotics need to be used appropriately. You need to, as short as possible, that is approved. You don't use antibiotics for too long. If a patient, the doctor says you use antibiotics for 5 days, make sure you use it for 5 days and make sure you finish it.
Yes.
Don't stop it after 2 days because you think you're
You're
feeling
feeling
better. Okay?
better.
Yes.
Yes.
Yeah.
So this brings us perfectly to the core of our podcast, When Food Meets Medicine. When someone with a chronic disease gets an infection and is prescribed, like you said, an antibiotic, and they're suddenly juggling multiple medications, what are some of the most common or critical food-drug interactions that patients should be aware of, both with antibiotics themselves and potentially with the existing chronic disease conditions? And I'm thinking of maybe sometimes dairy products with certain antibiotics, or like you mentioned earlier, grapefruit with statins, which many chronic disease patients take.
Well, I mean, there's some very well-known antibiotics, the quinolones. There's a lot of people use Cipro. I'm sure people have heard about Cipro. They've heard about Levoco. That has effect with dairy products, and you're not supposed to use dairy products or medication that has calcium, in it. You're supposed to at least stay away from them 2 hours or even 6 hours before the next dose and all the rest. That's the big. But the grape that you mentioned is very important. Your timing of medications. Some medications have a particular time that is like taking them on empty stomach or taking them on a full stomach, because some of them, not only the antibiotics, of course, there are viral medications too. They're antifungals too, but the big ones is that the quinolones that you shouldn't take, those things that I mentioned. The grapefruit, some food you need to take them with food. I mean, some antibiotics you need to take them with
With food.
some of them you need to take them without food on empty stomach. Your pharmacist will advise you about that. Okay.
Yeah.
So,
Yes, we do.
but it's the truth. You know what's there. Yeah.
And you're quite correct. There are absolutely essential reminders. As a pharmacist, I always emphasize you read your medication guide. But, also hearing it from an infectious disease specialist, it drives home the point that it is quite important to take your medication as prescribed or as a pharmacist has also counseled you. So beyond avoiding negative interaction, let's talk about proactive steps. What role does good nutrition play in bolstering the immune system, especially for individuals living with chronic diseases? Are there specific nutrients, vitamins, or dietary patterns that you recommend for patients to help them build a stronger defense against infection?
Well, nutrition is the basis of life. Good nutrition is so important. A balanced diet.
Yes.
Good protein, good carbohydrate, good fat intake that well apportioned and well given at the appropriate ration. Okay.
Yeah.
It is true that, like we said, that there's some foods that's good in your boost your immune system. It depends what you're talking about. There are some people who talk about, some nuts. You eat some nuts or you eat some berries. You eat. But bottom line is that eating very good food. Okay, probiotics are very good. After you've taken antibiotics. Sometimes we encourage them to take like yogurt. Yogurt is very good, but most importantly is eating a very, very balanced diet.
Diet.
I try to encourage my patients to run away too much from meat. Fish is very good. Red meat. Fish is good, like salmon. Salmon is very good. All those fish that have, like mackerel, they're very good. They have vitamin E, and they're supposed to be very good for the body. And they have omega-3 too. Most important thing is having good balanced diet. Okay, but the vitamins are not bad. I don't subscribe to people taking too much of mega vitamins. They call them multivitamins because you need them in very small quantity. And the multivitamin a day, personally, I believe it's not a bad thing after like age of 50 or whenever you want to take it, but not to be taking mega doses of food. Ginger is very good for the body. People use ginger to cook. People use garlic to cook. So those are some foods, that it's been proven that they're not bad. To add to your food. Fruits are good. Oranges are very good. Anything that grows from the ground is supposed to be very good. Okay.
Yeah.
So, but most important thing is balancing your diet and eating very well.
I think that's wonderful advice. It actually reinforces the idea that food truly is medicine in many ways. It's not, like you said, there's no magic bullet, but consistent, healthy choices, eating, like you mentioned, a balanced diet. So we're going to talk about, I know we've talked about chronic diseases, we've talked about infectious risk, and a critical tool in our arsenal against infection is vaccination. I know you'd mentioned Pneumovax earlier on, but I'll circle back. I know for patients with chronic disease or those on immunosuppressive medications, what specific vaccines, apart from Pneumovax, particularly important, and why are they? Also, if there's any misconception or special considerations that people should be aware regarding vaccination safety or efficacy.
Well, the issue of vaccination is quite broad, and it depends on a lot of things, age, your comorbid conditions. I would take. Let me just take diabetes. That's it. I'm going to talk about HIV too, because those are like models of situations that affect particular, cell type or the antibody, in patients. Okay, like the diabetic patient, like I said, it's your antibody that is the big problem there. Okay, the Pneumovax is very important. Like I said, the age is also very important too. And the season too. Like the Pneumovax. They're like the flu vaccination. At the flu season, you're supposed to get your flu season.
Yes.
If it's the RSV, you need to get your RSV infection. Your RSV vaccination.
Yes.
The shingles. Shingles is a big one too. For probably anybody now before by the age of 60 or so, you should get it. You know what I'm saying?
Yeah. Yes.
So hepatitis too. Anybody that was born between 1945 and 1965, they're supposed to be screened, for hepatitis C. Okay.
Yes.
If you are not protected with vaccination with hepatitis B, you are supposed to be offered that too. If you have the risk factor, like you are traveling, or if you have HIV disease, you should be offered hepatitis A vaccination if you need it, okay?
Yes.
Your tetanus shot is very important too. Tetanus, diphtheria, toxoid, if you have not had it for about, 10 years, the
10
last
years.
time, you should have it, and you should have a booster, okay? Oh, like I said, it depends on the age. The college students get meningitis, meningococcal vaccination. They're going to school,
Yeah.
HIV patients, I encourage to get it too. Sickle cell patients, get the pneumovax, like I said, the vaccine, other vaccination that's for the encapsulated organisms, the H flu, used to be they used to give it to children, H flu when they're younger, okay?
Yeah.
So
Yes.
it depends on your condition. But the big ones for older people that we're talking about are the ones I mentioned, your flu.
Yeah.
There's nothing wrong with the flu. Don't say that people get flu when they get it. Flu is not
Yes.
supposed to prevent you from getting flu. It's supposed to serve like an armor.
Yes.
So that if you get the infection, you have some protection against it. Okay.
Yes.
So a lot of people believe that when I get the flu vaccination, that I get sick. No.
The flu. No.
Yeah,
Thank
of
you.
course, you can have some side effects. People can have a low grade temperature. You can have some pain at the site. You can always take some time. Okay, RSV, you need to take it. And it's just whatever your doctor suggests for you to take. Depends on where you are, your vaccination record. You should follow your doctor's recommendation.
Thank you so much for pointing that, because I see that in my practice sometimes. People would say, the last time I got it, I got the flu. But no, it's not the flu. You cannot get the flu from a flu shot. And sometimes people forget that it takes 2 weeks most of the time for a vaccination to be effective. So if you've had the flu in your system, if you get it today, it's probably not going to work. But the flu shot reduces how sick you can get.
Yes.
And it's important that you pointed those guidelines. It highlights the need for personal discussions with your health provider. If the doctor is telling you to get some vaccinations, please go ahead and do it. I do appreciate it, because you truly have a unique perspective, having practiced medicine again across Nigeria and the United States through your incredible global infectious disease initiative. So could you share a bit about what you've learned from this global lens? Are there common challenges or different approaches to managing chronic disease and infection risk that you've observed between Nigeria and the US?
Well, we know what the problem is in the developing world. Okay? I'll give you a very good example. I have a relative who is 66 years old now, a male, okay, who has never had a PSA drawn, never had it done, never. All of a sudden started complaining of some eye symptoms. By the time they are going to do the PSA, it was more than 100. He started having back. So I now spoke to the doctor, who was taking care of. He's been taking care of him for a long time. I say, don't you guys have some guidelines that at certain age, you should do, so do some blood work, the CBC, CNP, colonoscopy, PSA, and all those things. He says, doctor, that is very difficult for them, because even if they do the test, it's not like they have any guidance. If they do the test, what do you do after that? Like if you had done the PSA test, and it was high, what are you going to do there in Nigeria? I mean, I only have experience in Nigeria. Of course, they have friends, have some facilities that they can go to, but considering the population of Nigeria, 230 million, I don't know how many of them are male. I don't even know how many women after the age of 40 get mammogram. I don't know how many people get colonoscopy. So those are all the things that developing worlds, and needs to pay attention to. Preventive care, because if you catch, we're talking about diabetes now. A lot of people, it can happen in America too, that, the first time you're going to know you're diabetic, your blood sugar is 400. It's possible. But if in Nigeria, in our own third world countries, people have regular checkup, after the age of 40, go to your doctor, get checkup, they do your blood work. Maybe they might start saying that your sugar is going up a little bit. They can start following it, you know what I'm saying? Your blood pressure too. If it's getting high, they can monitor it for you. So it's the problem of the care, and no guidance, in developing countries that bothers me a lot. I started the Global Infectious Disease Initiative, mainly because of course, I went to medical school in Nigeria, and the field of infectious disease, even up till now in Nigeria, is not a recognized specialty, because infectious disease in Nigeria, two diagnoses, okay? You have a fever, and they'll just say that, it's either malaria or typhoid.
Yes.
Yes, malaria or typhoid. So they will treat you for malaria first. I mean, they can do your blood work. Everybody in Nigeria, if you do their blood smear, they have some parasites in there. They treat them for malaria. They don't get better. They treat them for typhoid. They don't get better. They treat them for malaria again. So it was that notion that I wanted to actually make my specialty, be well aware to the community that, I mean, it's a very broad specialty, that, I mean, you can get a lot of advantage by having specialists, that specialize in infectious disease in Nigeria. So I did take some lectures there about 4 years in a row, to go and give them some lectures. I actually tried to start a medicine initial practice with my medical school. They gave me a place, I set it up, and they lost interest. COVID came, and all the things I put in there, I mean, shut down because they never used it. So those are the problems that we have. They have a lot of other things, so that's the problem, okay?
Challenge,
So,
lots of
yeah.
challenge. Your initiative that you started in Nigeria is inspiring. I know it speaks about your dedication to both patient care and medical education on a global scale, and that's
Yes. More
so
important to them.
yes, that's more important. And it happens here sometimes that there's some level of way people can get help. But to wrap up our main discussion, what are the top 2-3 actionable prevention strategies or pieces of advice you would give to our listeners who are living with chronic disease to empower them in reducing their infection risk and better managing their health overall? What should they be asking their doctors or pharmacists?
Okay. Like I said, the patient themselves, they the ones that are the most important. They have to be able to, realize that, knowledge is power. If they ask questions, like you said, their providers, can guide them. Okay. I mean, taking that responsibility that I want to survive is very important. In my practice, I started my practice about 30 years in Columbus, Georgia. And at that time, I just want to give you an example.
Yeah.
HIV was just starting, and we only had, like 2 medications when I started my infectious disease practice. Okay?
Yeah.
So most of them, they died. Most of them died. But a lot of them are still around now. And very interesting, the ones that are still alive now are the ones that are motivated, that, wanted the will to live. They survived to the point that, better medication started coming,
Yes.
and they're doing a lot of them still come to my practice, now. So what I'm just saying is that, that making people believe that, it's not the end of the world for you. There can be help for you if you believe that, you can do your own best and you can work with your doctor. It's a team effort, like I said. Work with your doctor and eat right, exercise right, and stay away from things, that are going to destroy you. Big ones, smoking. If you smoke, stop it. If you drink alcohol, stop it. If you are using drugs, you stop it. Those are preventable things, We're talking about routine things too. Like we said, age guided, things that, that you need to do. You are supposed to do your mammogram at the age of something, go and do it. If you are supposed to do your colonoscopy at the age of something, go and do it. You're supposed to do your blood work, go and do it, okay? Those are things that will make you...
test.
do a PSA. Those are things that's going to, make things be caught at the very early stage so that it can be prevented.
Yeah,
and I just believe that if you really want to, of course, there's some diseases that come. You can have leukemia, that can just come and
you're not prepared for, and there's nothing you can do about it. Yes,
but eat right and stay away from things that that can destroy you. And most importantly, use your seatbelt too.
Thank you. These are powerful and practical takeaways. And thank you for making it so clear and so simple. So now we're going to go to a section where we called rapid questions. We're shifting gears. So for a moment, I'm going to ask you like quick 5 questions. So you're just going to give us the first thing that comes to your mind. Okay. So what's one common misconception about antibiotics that you wish everyone understood?
That I don't need to take it for the length of time that is being prescribed. And once I start getting better, I can stop it. And I need antibiotics all the time.
Okay. If you could only recommend one food group for immune health, what would it be?
Berries. Fruits.
Okay. Beyond medicine, what's one hobby or activity that helps you de-stress? Yes, you.
One activity? Very interesting. I intend to be more active very soon, and I encourage you to be more active. Okay.
Okay. So what's the most surprising food-drug interaction you've ever encountered in your practice?
Very interesting. We are talking about,
Grape,
we are talking about
grapefruit.
grape. Yes,
Okay.
grape. Grape that you shouldn't take it
The
with
grape
the
rice, yeah.
project medicine. The TSM or whatever it is. Okay.
Yeah.
I've seen multivite too, and some HIV medications. Multivitamin tablets that when you take it, because they have some cations and all the rest that
Okay.
affects absorption.
Mm.
Of the some, not all HIV medication, but some of them.
Some.
Okay. Yeah.
Uh-huh.
So, but that's, I mean, for my own specialty, that's the big one. So I tell my patients to separate the, multivites. If they're taking it, don't take it with their HIV medications. Mhm.
So what's one piece of advice you'd give to a young medical student today? Perhaps even one inspired by your own journey from Unilab to your current practice.
Don't give up on your dreams, and don't give up on your hopes.
Yeah.
Believe in yourself that you can get whatever you want to get. You can do anything you want to do as long as you put your mind to it. Know where you stand. In your ability. Some people study for 5 minutes, they get it. Some people have to study for 1 hour before they get it. Know where you stand, okay? And hang around colleagues that are going to lift you up, okay? And choose your specialty. I will tell you that for the truth. There are some specialties that are good, that are very rewarding,
Tea or coffee? What do you take, tea or
Tea or
coffee?
coffee for who?
For you, what do you take, tea or coffee?
Oh, I drink coffee in the morning. 1 cup in the morning, that's it.
Thank you for playing along. Surprising answers, but I'm grateful. Dr. Lua Oluwale, this conversation has been incredibly illuminating and so very valuable. I particularly appreciate your insight into the challenges we have globally of infectious disease and the work you do, bringing world-class education back to Nigeria, and your practice advice on antibiotic stewardship and nutrition. It is very important for every listener if they can apply it, like you said. Thank you for sharing your immense knowledge and experience with us today.
Thank you very much. I appreciate it. Thanks for inviting me. I'm really very proud of you, Remy.
Thank you, sir.
You keep up the good job, okay?
Thank you, Dr. Oluwale. So, as we end the show today, I want to encourage people to see what powerful takeaways what we've had today. Let's quickly recap some key points. Chronic disease, it weakens your immune system, making you more vulnerable to infections. Managing your chronic condition well is your first line of defense. Antibiotic stewardship is crucial. Use antibiotics wisely, as Dr. Lubale said, only when prescribed, and finish the full course. Don't pressure your doctor for them when they are not needed. Be mindful of food-drug interactions, especially with antibiotics and chronic disease medications. Always ask your pharmacist or doctor. Prioritize good nutrition and vaccination to booster your immune system, especially if you have an underlying health condition. This episode truly highlighted how critical it is to understand the full picture of your health, from chronic conditions to immune system to every pill and every bite of food. So for more resources on medication safety and food-drug interaction, please visit my website at www.pharmaplansystems.com. There you can also get my book, When Food Clashes with Your Medication, which dives deeper into this important topic. So if you enjoyed this episode, please subscribe, leave us a review, share with your family or friend who might benefit. Your support helps us reach the people with vital health information. Join us next time on When Food Meets Medicine as we explore another fascinating intersection of health and wellness. Until then, stay curious, stay informed, and remember, when food meets medicine, knowledge is your best protection.
Thank you.